everyone. I just wanted to say hello before we get started on the talk. I'm Dr. Amy Doneen. I'm coming to you today from Spokane, Washington, and I'm so thrilled that you all are here. I'm looking forward to this evening. Everybody is welcome. You don't have to have any pre-knowledge to understand this talk. And our hope is that you learn, you advocate for yourself, and you share with others. We are going to tape this. It is being taped, and we will post it in various places if you'd like to watch again or share with others. So I'm going to close my camera, but I just wanted to say hi so you could see that I'm really here, and let's get going. Okay, so today's talk is titled Taking a Stand to Protect Our Hearts. My focus is on awareness, education, and prevention. Women can live free of heart disease, and that is a really, really important, hopeful, and true statement. So we're going to focus today on information that's in our book. My partner in this for 22 years, Dr. Bradley Bale, and I have two books. The first published in 2014 called Healthy Heart, Healthy Brain. Beat the Heart Attack Gene, and then our latest in 2021, Healthy Heart, Healthy Brain. And the information I'm sharing today, you can also read in our book. We're going to talk about education, awareness, action, and then advocacy. So let's just make ourselves knowledgeable of the facts. Heart attacks occur every 25 seconds. Every minute, someone we love dies from a heart attack. Strokes occur every 40 seconds, and women have the highest rate of repeat strokes. And young women have the highest rate of repeat, or what we call recidivistic stroke risk. We live in a healthcare system that's truly focused on sick care rather than healthcare. And that's part of the problem. We aren't identified to be at risk until after we've had a catastrophic event, like a heart attack or a stroke. But what I hope you garner from today's talk is that there's a lot of opportunities throughout our life that we can identify our risk, do something about that, and therefore prevent those catastrophic outcomes. You know, what we all want, truly, I think, I ask people every day, I ask myself every day, what does health mean to me? And really, it's that our health matches our lifespan. We want to live well throughout our entire life, be independent, enjoy, learn, share. And right now, there's about a 13-year age disparity between our health span and our lifespan. That simply means we live the last decade plus of our life in poor health. And that it just doesn't have to be that way. So we must stand in unity to advocate for one another. Education is the first step in this process. It's time for change. Heart attack related hospitalization rates for women ages 35 to 54 have increased from 21% to 31%. We simply can't wait any longer. We must ask, why are these statistics occurring? Why are they not getting better? We need to change how women are treated. We deserve better. So how is it going to get better? Through education and awareness. These are the very first steps we need to take together. So let's start there. Women's awareness of heart disease is sadly declining. A survey of US women over age 25 was conducted in January of 2009, and then again in 2019. Sadly, in 2009, awareness that heart disease was our leading cause of death was at 65%. 10 years later, that awareness decreased to 44%. Doesn't make any sense, does it? And ultimately, the greatest declines in awareness were among the most vulnerable: Hispanic women and non-Hispanic Black women, young women ages 25 to 34 years of age, and even women with high blood pressure were the least aware of this catastrophic reality. Heart disease awareness is declining while cancer and breast cancer awareness are increasing. And perhaps that's a reality of the system, that cancer and breast cancer awareness are doing a better job educating women, which is wonderful. And it's a very important thing to do. However, it doesn't mean that we need to decrease the awareness on cardiovascular disease in order to increase the other. All of them should be increasing. Heart disease is more deadly than all forms of cancer combined. Annually, in American women, 1 in 31 die from breast cancer. 1 in 3 of us die from heart disease. With that being said, there's a lot of synergy between breast cancer and heart disease, both from a risk factor standpoint. We know that obesity increases our risk of breast cancer and heart disease. We know that certain foods and diets and stress and genetics increase our risk for breast cancer and heart disease. And then sadly, the treatment that's necessary and wonderfully available to treat breast cancer also places us at risk. Women who receive breast cancer treatment, including chemotherapy, radiation, or even estrogen suppression, had increased risk of developing heart failure, stroke, heart attack, and cardiovascular related deaths. Education is key. Educated women show the greatest awareness of heart disease. So that's the first step, most certainly. I also wanted to bring up the reality that, in case you didn't know it already, women are very different than men. And women, we present very differently oftentimes of our symptoms of a heart attack compared to our male counterparts. 64% of women who die suddenly of a heart attack have no idea that they are walking around with heart disease. Matter of fact, at the time of a heart attack, women had a greater number of non-chest pain symptoms than men, including things like nausea, heartburn, stomach pain, shortness of breath, and even anxiety. And when you look at those symptoms, anxiety, stomach pain, nausea, we can blame those on a lot of things, can't we? We can even blame them on menopause and perimenopause. We can blame them on a bad day. We can blame them on so many things. And I always say, if we realize that heart attacks are our #1 cause of death, and strokes are our #1 cause of disability, I say, if you feel differently than you've ever felt before, consider the fact that it could be a heart attack. Get in and get evaluated. Don't second guess yourself. Compared to men, women with diabetes have a 44% higher risk of heart attacks. Women compared to men who smoke have a 25% higher risk of heart attacks. Did you also know that women who experience intimate partner violence and domestic abuse have a 44% increased risk of a heart attack? Women who live alone report greater barriers to care, such as greater financial issues, isolation, and access to care. So let's do something about this. Let's shatter these statistics with awareness and advocacy. So how do we become aware? Like, how do we know we might have risk before we have an event for our healthcare system to tell us that something has been amiss for perhaps 20 years? What are what we call red flags? These are things that perhaps we don't quite understand the risk, and it may not be causal, but it's certainly present. If we have one of these red flags, which all of us do, by the way, we have one or many, but if you have a red flag, realize that that places you at an increased risk throughout your lifetime to develop heart disease. So what are some of these? Red flags are in abundance. We have all these opportunities to find out we may have risk. And what women have is this wonderful opportunity throughout our lifetime to recognize different red flags based on the phase of life we are in. So let's talk about some of these red flags. First, let's just look in a mirror. Let's look in a mirror. And there's something called Frank's sign. And everyone gets a kick out of this one. And we actually do too, because now that you know this, you can't stop looking at people's earlobes. But basically, Dr. Frank had discovered that individuals, male or female, one side or both sides, if there's a crease, a diagonal crease in the earlobe, like you see here, and as we get older, they become more pronounced based on collagen in our skin and so forth. But if we have what we call Frank sign, we have a 78% increased risk of developing heart disease in our lifetime. Amazing. So let's examine a few red flags as we go through various stages of our lives. Let's look at migraines and then pull that into vasomotor symptoms as we get older and hit perimenopause and menopause. Vasomotor symptoms are things like poor sleep, hot flashes, vaginal dryness, brain fog, etc. So we know that migraines carry an increased risk of stroke throughout our entire lifetime. And this study was a prospective analysis of taking women with migraines ages 18 to 30 and looking at them prospectively as they went through life. And those women that later developed persistent vasomotor symptoms of menopause had a 3-fold increased risk of stroke. What about our resting pulse? 26% increased risk of a heart attack for all women with a resting pulse rate of greater than 76 beats per minute. So if your average resting pulse is higher than 76, that is a concern and you need to get in and get checked out. The highest risk was found in women ages 50 to 64. It was predictive of all ethnic groups, and it was independent of physical activity. What about polycystic ovarian syndrome? Women with PCOS are 3 times more likely to have heart disease, 3 times throughout their lifetime. So what is PCOS? Basically, important to note, it's very common. It affects 1 in 10 women, and it's a hormone sort of imbalance throughout a woman's lifetime that creates symptoms as you see here. Oftentimes infertility, mood changes, acne, fatigue, prediabetes, high testosterone levels coupled with low sex drive, which is a bit of a disparity, but excessive body hair growth, weight changes and trouble losing weight, cysts on the ovaries, irregular or missed periods, and male pattern baldness or thinning hair. Of interesting note that a lot of people don't know that the brothers of the women with PCOS have an equal 3-fold increased risk of cardiovascular disease in their lifetime, and they may not know it. Let's examine pregnancy. It tells us such an important story about our future cardiovascular health risk. And it's such a wonderful opportunity to realize how marvelous our bodies are and also give us an insight of perhaps red flags that give us years, hopefully decades and decades of time to deal with it. If we deal with gestational diabetes, which is diabetes during a pregnancy, it tells us a really important story. And that is adverse pregnancy outcomes are common. They occur in 10 to 20% of all pregnancies, particularly in gestational diabetics. And gestational diabetics have a twofold increased risk of developing flat out diabetes in their lifetime, and a 68% increased risk of developing cardiovascular disease. I often say if someone struggles with gestational diabetes during a pregnancy, it's not a matter of if they will become diabetic later in life. It's a matter of when, but it doesn't have to happen. But that's how the statistics are currently unfolding. What about preeclampsia? What is it, first off? Preeclampsia is a pregnancy emergency. The only way to treat preeclampsia truly, because it's a life or death risk with the child and the mother, is to give birth. Symptoms often happen quickly, and you'll see things like high blood pressure, protein in the urine, swelling of the hands and the face, intense headache, sudden weight gain, seeing spots or vision changes, stomach pain, nausea and vomiting. When preeclampsia is present and it's treated and mom and baby are healthy, which is wonderful, that mother still carries with her throughout her lifetime a twofold increased risk of heart attack and stroke in 10 years post-pregnancy. And she carries a twofold increased risk of having a venous blood clot, like a blood clot in the leg, in 4 to 5 years post-pregnancy. So that's important to note, because if someone had preeclampsia during pregnancy, you'd want to make sure that everything is done for a full cardiovascular evaluation after the birth of the baby. Matter of fact, it's recommended at 3 to 6 months post-birth that women are recommended to get a cardiovascular health evaluation. And it's not done, sadly, often enough. What about high blood pressure during pregnancy? Women with high blood pressure during pregnancy have a 41% higher risk of heart attack or stroke. And by the way, these statistics don't mean at the moment, they mean throughout our lifetime. So that's why it's important to realize and even reflect upon if you're post this stage of your life. What about menopause? You know, our mean life expectancy is about 81 years in the United States, which means we will spend upwards to almost half our lifetime living postmenopausal. Almost half our lifetime. And in reality, it's not discussed enough. It seems to be this sort of out there topic that we spend half of our life in. And so it's important we recognize that menopause changes who we are innately from an hormone status, the hormones that we create and make on our own. Everything changes. Postmenopausal women have a 2 to 6-fold greater incidence of heart disease than premenopausal women. And women that enter into menopause early, like it could be surgical, like a hysterectomy, or natural. But for women that enter into menopause, which is cease of menstruation, under age 40, the risk is escalated. 40 to 44, 3.6 incidents per 1,000 women, and it goes up 45 to 49, and then 50 to 54. So across the lifespan. Then when we look at, well, what about hormone replacement therapy? You know, just to kind of go back and not dwell too much and take too much time, but there was a big study called the Women's Health Initiative, where they looked at giving women in menopause hormones. And the study was, I will humbly say, very poorly designed. And some of these women had been in menopause, whether it had been a surgery or natural menopause, for more than a decade before they gave them hormones. And it really didn't pan out. And women were having cardiovascular events. And so from that time, hormones were labeled bad, but we know so much more than we do now. In this really well done, beautiful meta-analysis, it was demonstrated, and this is some of the newest data, that hormone replacement therapy can reduce cardiovascular disease by 30 to 50% when utilized before age 60 and within 10 years of menopause. this decision to use hormone replacement therapy is extremely individual and must be discussed with your healthcare provider. And we now have the tools where we can monitor our inflammation and our clotting risk all the time, and particularly if we're on hormone therapy. So it's a very individual thing, and it's not a yes or a no issue. And I think that's the most important thing to recognize. Women are often caregivers later in life. And when women are caregivers, or anyone for that matter, although the data, by the way, was stronger in women than in men when they evaluated this study. But think about it for a minute. People who are caregivers oftentimes do not maintain their own health. They don't get to the dentist regularly. They don't get in for their evaluation of their health. They don't get regular exercise. Their nutrition is compromised, and yet the health focus is on their loved one. And so women who are caregivers later in life had a 17% increased risk of heart disease within the first 1 to 4 years of that caregiving role of someone who was ill and unable to care for themselves. And stroke risk showed a 36% increased risk when that woman was a caregiver of a intently ill person for over 5 years. And that's after the time the neighbors are aware. It's after the time that people are on meal chains or on prayer lists at their places of worship. So I think it's just it's important to recognize our neighbors and important to recognize one another's needs as we go through life. Okay, so many of us are at risk for heart disease. We can acknowledge that. But okay, so we acknowledge that, but I don't want to end with that. I want to now realize that we can do something about it. So let's talk about what we do. Let's say that you had a few of those red flags. And by the way, there are so many more red flags: gallbladder disease, kidney stones. I could go on and on of all the red flags, but we talk about them intently in our book. So I just wanted to focus on women at this point. So let's admit that many of us have red flags. So let's do something about it. So let's shift gears and focus on taking action with the intent to protect our hearts and our brains. So for the next 20 minutes or so, we are going to talk about this, and we will have conclusions. So we have about 25 minutes left. So let's now shift gears and focus on being proactive. First thing, why are heart attacks such a shock? You know, when someone's fine on Monday and not on Tuesday, not only are they shocked, but the world is shocked. And sadly, that's how our healthcare system deals with it. And part of the problem is plaque, which hides in the artery wall, is really sneaky. I mean, it hides in the artery wall. It doesn't present itself in where blood flows, where we might find it. And even common things like stress tests aren't going to find it because it hides in the artery wall. 99% of plaque grows in the wall of the artery. So you can be living your entire life with plaque in your arteries and not know it until it misbehaves. And when it misbehaves, then we have a problem. I'm going to show you this really short little subsection of a video. And what I'm going to show you is a really sort of large scale analysis of what happens when someone has a cardiovascular event or a blockage. I'm going to turn off that sound if I can. Whoops, let me pull it down here. So what we're going to see here is we're going to see a cross section of an artery, and we're going to look here where there happens to be plaque. And I'm going to show you, I'm going to let it play out on what happens if this plaque is not identified, number one, and not treated, because this is a treatable condition. So I'm going to play this out. And as you see, plaque hides in the artery wall, and through different mechanisms of oxidative stress, that plaque can be active and it can rupture the artery wall. And no different than if we cut our hand, our body is going to heal it with a blood clot. That's a scab or a blood clot. And it happens so aggressively and so acutely where all of a sudden that artery is blocked and blood can't flow anymore. And when that happens, let's say that that happens in the heart right here. Well, if you get a blockage and the muscle around that blood clot doesn't get oxygen, that's a heart attack. Let's say the blood clot happens in the brain and the brain doesn't get oxygen. That's called a stroke. The other thing I will tell you, and I don't have time to dwell on it today, but we've got 30,000 miles of arteries that feed nutrients to the top of our head, to the tip of our toes, to the tip of our fingers, and everywhere in between. And what causes diseases of aging, like dementia, vision changes, kidney disease, peripheral vascular disease, it's the same pathology, the same process. It just happens in little tiny vessels where they get blocked, and it happens chronically over time. And as we age, we don't get the adequate blood flow to our brain, to the tip of our toes, and those are the diseases of aging that compromise our independence. So it's the same process, the same process. Okay, so if you're telling me that plaque hides in the artery wall and we don't feel it until we do, and then it's a crisis, and then we're told we have heart disease or vascular disease, is there a test that can find this plaque before I have a blockage? I mean, is that possible? Yes, there are a couple of tests that are extremely safe and effective. Well, will my insurance cover them? Sadly, in most cases, no, but it doesn't mean you can't ask for them. Just because insurance doesn't cover a test does not mean you don't have the right to get it. Well, okay, I may ask for it, but I probably can't afford it. I mean, a heart attack could be up to $500,000. These tests must be incredibly expensive. The reality is they're not. The cost of these tests is roughly $50 to $300, and insurance, again, usually doesn't cover it. And the cost is going to vary based on your location. And while $300, $100, and $50 is a lot of money, if you know it's available, it's your choice to save and allocate your resources to getting these tests, but you're going to have to ask for them. So what are they? There are a few, there's many, there's more than I'm telling you here, but a couple that are widely available and very safe. One is an ultrasound, and it's called a carotid intima media thickness test. And we know what normal is down to age 5, all the way up to about age 85 to 90. And it's simply an ultrasound that shoots the ultrasound beam and looks at the wall of the artery. I do not want you to be confused with a company called Lifeline Screen that does this. They look at blood flow. Doesn't mean that's a bad test, but the plaque is more sneaky. It doesn't hide in the area of blood flow. You need a test that looks at the wall, and that's this test. Another one that can look at calcium in the heart, in the arteries of the heart, is called a coronary artery calcium scan. And in order to develop calcium on plaque to be picked up by a scan like a CT calcium scan, it takes a while. So it can't find, actually, ironically, the more dangerous soft active plaque, but it can find calcium. And if you have calcium in any artery, that means you've had plaque for quite some time, long enough, in fact, for it to develop calcium. These tests are readily available, and I would advocate that you ask for them, and we talk about them a lot in the book, so you have the words and the studies and the background to help advocate that you may want these tests. So education, we've talked about what causes a heart attack or stroke. It's a plaque in the artery wall that can rupture, and in that process, the body tries to heal it. And wherever that clot decides to land, we'll give it a name. If it lands in the brain, we're going to call it a stroke. If it lands in the heart, we're going to call it a heart attack. We also know that there's tests we can ask for to find hidden plaque. And we also talked about awareness, understanding our red flags and knowing that we have these opportunities throughout our lifetime to say, hey, I matter and I want to get evaluated. So taking action means we need to find out what actually causes this plaque. What causes plaque? And there are lots of what we call root causes that cause plaque in the arteries. And I've listed them down here. This is an illustration that we really enjoy because it's so beautifully drawn by a cartoonist by the name of Moss Friedman. But I want to just point something obvious, and that is the current guidelines look at three things on this chart. They look at our cholesterol, and they really look at the wrong one. They look at just LDL. They look at blood pressure, and they look at the fact that if we are exposed to nicotine, we should stop. Those are three of many things that have equal play in the development of arterial inflammation, or what we call oxidative stress, that leads to plaque development. So part of the challenge we have, ladies, is that if all we're evaluated for is our blood pressure, our cholesterol, and exposure to nicotine, all of these root causes are going to be missed. So let's talk about them as they relate to us in women. And obviously, I can't talk about all of them, so I'm going to hit some high points. First off, I want to talk about cholesterol just a little bit. First and foremost, do you know that over 50% of people who have a heart attack have normal cholesterol? Shock, but it's true. I want you to take note of three important numbers that when you get your cholesterol checked, I want you to know what they are. The first one is a ratio, and it's taking our total cholesterol divided by our good cholesterol, called HDL, and most labs calculate this for us. The goal that I want you to have is for that ratio to be under 3.0. And if it's not, get in and ask why and what you can do about it. Number two is ask for a lipid called ApoB. It's much more predictive than the traditional cholesterol number called LDL. ApoB is a measurement of all the bad guys, all the bad guys. So make sure you know what your ApoB is. And if you've never had a heart attack or stroke before and you don't know if you have plaque, you want that number to be under 80. The third one I want you to ask for is something called lipoprotein A. You either have it or you don't. It's a lipid abnormality. It's found on chromosome number 6. 23% of people carry it, and it's independently causal of a heart attack. So find out if you have lipoprotein A. It can be done at any lab. Okay, let's look at some roots that don't get enough attention. Let's look at things like autoimmune diseases, our psychosocial health. Let's talk about blood pressure a little bit, insulin resistance and airway, and even oral health, our dental health. Let's talk about autoimmune. And so the format that I'm going to go over on these is I'm going to talk about autoimmune, the prevalence, and what some of them are, and then talk about what you should do if you have an autoimmune condition. First and foremost, women have a higher rate of autoimmune conditions. 78% of women with autoimmune versus men. And you can see the variances. This is women to men as far as incident rates of these issues. Let's talk about them though a little bit. Rheumatoid arthritis. Do you know it increases risk of a heart attack by 7-fold? Lupus more than triples the risk of a heart attack in our lifetime. Severe psoriasis, 50% increased risk of cardiovascular death in our lifetime. Sjogren's greater than doubles the risk of a heart attack. Sjogren's is an autoimmune condition that the most common symptoms are dry eyes and dry mouth. There's more to it than that, but those are the two most common symptoms with Sjogren's. Crohn's disease increases the risk of heart attack by 24%. That's an autoimmune condition of the GI tract. And then Hashimoto's thyroiditis, which is an autoimmune attack on the thyroid, increases risk of heart attack by 50%. So if you have an autoimmune disease, optimal lifestyle is critical. Let's talk about it. Diet. We use genetics to guide diet, but on average, following a very healthy Mediterranean diet, avoiding inflammatory foods, which the four most common are alcohol, gluten, dairy, and sugar. Eating in a narrowed food window, like eating, from a 12-hour window or even a 10-hour window, and avoid the snacks late at night and the little, what I call BLTs, the bites, the licks, the taste. Let your body rest, let your liver rest, let your pancreas rest, let your body rest from metabolizing all that food. Hydration, goal is 50 to 100 ounces of water a day. That's a nice round figure. Exercise, daily movement for at least 30 minutes. Consider all: Zumba, Tai Chi, yoga, walking, biking, dancing, rebounder, grip strength, standing. Laughter reduces inflammation. Saunas reduce inflammation. Mindfulness, practice daily for 15 minutes, reduces stress and anxiety, and also improves inflammation, particularly in patients who are dealing with chronic pain, often a part of autoimmune diseases. And get adequate rest. Respect the amount of sleep we need, which is more than we often think we need. And stay on your treatment. If you're on a treatment for your autoimmune disease, those treatments also reduce your cardiovascular disease risk. So really important to seek that treatment and stay on it. What about gut health? This is another root cause. We call it gut dysbiosis. When we pay attention to our gut health, we get decreased inflammation. So that includes eating pre and probiotic foods like fermented foods. Get at least 25 grams of fiber a day. Coffee, believe it or not, is usually good for gut health. Avoidance of saturated fats, avoid all artificial sweeteners, and avoid all soda drinks, diet or regular. Do not have them anymore after tonight. Let's talk about our mental health. That is so important and under-recognized. It is a root cause of heart disease. What is stress? What is it? It's different for everybody, but the most unifying definition is the following. If you believe you're in an environment for which you perceive a lack of control, that creates inflammation and oxidative stress in our body, in our arteries, that drives plaque development. So I'll say that again. Stress is defined as being in an environment for which you perceive a lack of control. We often can't change our environment, but we can learn to change our perception of control over that environment. When we look at things like anxiety, 50% higher risk of cardiac death, post-traumatic stress disorder increases heart disease risk by 60% in women when they've been followed for over 20 years. Depression is associated with a 2-fold increased risk of stroke, which is a really big deal, obviously. So let's take action to reduce emotional stress. Let's take a look. Yoga and meditation reduce aging and oxidative stress. Loneliness gives us about a 29% increased risk of heart attacks and a 32% increased risk of stroke. Social isolation is not a healthy place to be and dramatically decreases lifespan. So get yourself involved in different groups. Get yourself engaged in the community. Find purpose. Find friends, etc. Cardiovascular risk was significantly reduced or lower in people who were optimistic versus those who were pessimistic. Ask yourself, is the glass half full or half empty? Also, when you're thinking about being mindful, ask yourself, is my mind full or am I being mindful? Am I present in this moment? Tai Chi reduces heart disease risk. Wonderful activity and also a social activity. Women with more self-compassion have less vascular disease. Be kind to yourself and be kind to others. And do not avoid getting professional help. Conditions such as post-traumatic stress, depression, anxiety, there should be no social stigma to seek help, get help, and maintain health. Our mental health counselors and mental health professionals are there to help us, and we need to seek it out and take advantage of that. What about blood pressure? We hear about it all the time, like, oh, check my blood pressure. Oh, and how often do we check it? Going to the doctor once a year. Maybe if you're lucky, your dental office does it. All dental offices should be doing it, by the way. But how many of us have a blood pressure cuff at home? I want that to change after tonight. Do not wait to go to the doctor once a year to know what your body's telling you. And by the way, normal blood pressure is under 120/80. The top number should be under 120. It's called the systolic blood pressure, and the bottom number should always be under 80. That's the diastolic. What if you're young? Like, does my blood pressure really matter? Do you know that a blood pressure routinely that's greater than 120/80 at age 53 is associated with brain volume decrease and memory loss by the age of 70? So if we want to protect our brain, we need to protect our blood pressure when we're young to protect it as we get older. Simply by keeping our blood pressure under 120/80 reduces stroke, dementia, blindness, heart disease, kidney disease. It reduces aneurysm risk, and it reduces peripheral arterial disease as well if we just monitor our blood pressure. So what do we do? First and foremost, measure it in the morning. Wake up, sit up, have a blood pressure cuff, measure your blood pressure and start recording it. Then measure it periodically. Know what it is. Remove the fear of a test. Remove the anxiety of getting your blood pressure checked and bring those in. Monitor it and bring it in for your healthcare provider to evaluate. Wrist cuffs are fine when they're done properly. Get your feet flat on the floor. Don't have your legs crossed. Put the cuff at heart level. Have a blood pressure cuff in your home at all times. If you have small kids, remove the stigma. Get blood pressure cuffs you can get for 20 bucks. If they break them, no big deal. Let them play with it. Let them understand that it's not a test and something to fear. This white coat hypertension that you only get elevated levels when you're at the doctor's office needs to change by understanding our levels at home. Goal remains under 120/80. Anything higher, report it. Lifestyle treatment that improves blood pressure. We have data to show movement, exercise, laughter, mindfulness, proper sleep, optimal vitamin D levels, low sodium, hydration, eating more vegetables, hibiscus tea, beets, antioxidant foods, regular dental checkups, all statistically reduce blood pressure. Pharmaceutical intervention may be necessary if your blood pressure remains above 120/80 in order to protect our brain and our heart. Insulin resistance or diabetes. Boy, this is so common. Do you know that 86 million people, basically more than 1 of 3 adults, have pre-diabetes? 9 out of 10 do not know they have pre-diabetes. Why? Because it's not checked. We wait until someone's diabetic to tell them. And do you know people are mostly pre-diabetic for 20 years before the pancreas doesn't have enough oomph and kick to produce enough insulin that we are called type 2 diabetic. Type 1 is a different ballgame, people. That's when the body is attacked by either an autoimmune condition or a virus, and it's more common in children. I'm talking about diabetes that we can get as adults. 1 out of 3 people suffer this, and they're not picked up until later. 70% of people with heart disease have prediabetes. 50% of stroke patients have prediabetes. It's often a 20-year path to become diabetic. It's a syndrome. The sugar is the last thing to go. The commonalities with insulin resistance include blood pressure, fatty liver disease, low HDL, even kidney stones, blood pressure changes, all kinds of things, all of this inflammatory action that damages the arteries over time. A fun thing for you to be aware of are continuous glucose monitors. They are available. You do need a prescription in the US, but if you're not diabetic, your insurance won't pay for them. But you can ask your provider, and the cheapest place we've found to get them is cash pay is at Costco. And one little sensor lasts a couple weeks, and it's wonderful. The biofeedback is here, and use it. Understand what your body does after you work out. Understand what your sugars are doing after you eat. Understand what they're doing when you have a poor night's sleep. Know what your body is telling you. So, and also know your sugar numbers. As you know, as I said, 70% of heart disease patients are either insulin resistant, which is prediabetes, or diabetic. Don't wait to find out. Fasting blood sugars should always be under 100. There's something called an A1C that's very common to measure. It should stay under 5.7. Get a glucose tolerance test. We do it during pregnancy. We need to do it as we get older. I would advocate annually. It's a 75-gram glucose load. You check your sugar at 1 hour and 2 hours. And at 1 hour, it should be under 125. And at 2 hours, it should be under 120. Very simple. If diabetic, keep tight glucose control and use what we call a CGM, continuous glucose monitor. They're wonderful. Ask for one. Optimal lifestyle can reduce the risk of becoming diabetic by 75%. Keep your waistline under 35 inches. Move daily for at least 30 minutes. Do resistance training to improve muscle health. Keep a narrowed food window. Mediterranean, vegetables, good fats, limit carbs, avoid alcohol, no soda, diet or regular. Diet or regular increases your risk twofold of becoming diabetic. Coffee, usually 2 to 3 cups are beneficial depending on your genetics. And obviously I'm talking about black coffee. Genetics, use genetics to guide your diet. We measure things like the ApoE gene and haptoglobin. We talk about that in our book, and these again are tests available to you if you seek them out. Certain supplements can also reduce our risk of becoming diabetic. Things like berberine and turmeric, cinnamon, melatonin, vitamin K2, MK7, chromium, and vitamin D3. All can reduce our risk of becoming diabetic. What about airway and just good sleep? And then let's talk briefly about oral health. Do you know that your dentist and your dental hygienist are extremely important members of your healthcare team? They can identify these root causes like sleep apnea, sleep quality, sleep quantity, oral health balance, periodontal disease, and endodontic disease. So make sure you're going to the dentist and seeing your hygienist regularly, because a big part in maintaining your heart health. More than half of, let's talk about sleep for a minute. More than half of women in menopause and menopause transition have sleep issues. Untreated sleep apnea doubles the risk of heart attack, stroke, and cardiovascular risk. Poor sleep quality and quantity increase obesity, type 2 diabetes, and blood pressure. And if menopause, what we call vasomotor symptoms, are contributing to this, as we talked earlier, if hormone therapy is something that you are safe to do and qualified for, by reducing some of these vasomotor symptoms, we can also reduce some of the cardiac consequences from them. Adequate sleep is essential to reduce vascular risk. If you don't sleep well or sleep enough, it worsens blood pressure, resting heart rates are higher, it leads to weight gain, leads to insulin resistance and diabetes, vascular inflammation, heart rhythm problems can develop. It can lead to basically what we're talking about: heart attacks, strokes, and memory loss, and overall poor sleep quality. Measure your sleep. You get an Aura ring, get sleep number beds, use the watches, use biofeedback, talk to your healthcare team about your sleep. Watch your children. Many children have sleep apnea and aren't tested and aren't aware for it, but children should not be mouth breathers. If they are breathing through their mouth, their airway is compromised. Get tested for sleep apnea, and if you have it, get treated. And PS, if your bed partner is keeping you awake from apnea, get him or her tested immediately as well, because that's affecting your health. All right. Oral health is an essential piece of the puzzle. Oral health is critical to control vascular inflammation. Mouth breathing is not good. Hormone changes also affect gum health. Mouth breathing dries out the gums and leads to periodontal disease. Same with hormone changes. Optimal home care, electric toothbrushes, floss, water pick, etc. All critically important. More frequent visits to your dental office. Get cleanings every 3 months, and know your insurance probably doesn't pay for that, but it's one of the best insurance policies you can make for yourself. Keep your gums healthy and your teeth healthy. Ask to get your pathogens. Those are the bacteria, the dangerous ones that can live in our gum line that cause heart attacks and strokes. Okay, so let's review what we discussed today. So, education. Understand that heart disease is our #1 cause of death. Heart attacks are absolutely preventable. Awareness. Identify your red flags. We all have them. We all have them. Take action. Ask yourself, gosh, do I have hidden plaque in my arteries? We don't know until we look. You can't tell it's there until it misbehaves. And that is where our healthcare system is at right now. Once you have a blockage of blood flow from that plaque rupturing and you forming a clot to heal it, you're not going to know unless you get tested. If that clot occurs, it's a medical emergency. You can find out if you have hidden plaque. A couple tests that we talked about were the carotid intima media thickness, which is a very inexpensive, safe ultrasound, looking at the wall of the artery, or looking for calcium in any artery, particularly in the heart. It's called a coronary artery calcium scan. Ask for them. Identify your root causes. We talked about a few today. We talked about your lipids, looking at your ApoB and your lipoprotein A and your total cholesterol to HDL ratio. We talked about optimal blood pressures. We talked about autoimmune conditions. We talked about mental health. We talked about oral health and sleep. All of those are root causes, and there's so many more. Again, we really talk about these in our book. And advocacy is so important. You are important. Read, get educated, and ask for tests. Just because your insurance doesn't cover them doesn't mean you don't have the right to get them. Remember, our healthcare system is not a healthcare system. It is a sick care model. It treats us after we're sick. We're talking about advocating for ourselves and asking for things so we don't get sick. And then I do ask that we share this information with others. Try to remember 3 things from this talk, just 3, and tell somebody about them tonight and tell somebody about them tomorrow at least 3 times. Once we say this 3 times at least, these 3 things we've learned, then we will remember them. As I said, this talk is it is recorded. We're going to have it posted so you can watch it again and learn some more things. You can also read our book. It's published by Little Brown Spark. It's not self-published. So we get it ourselves on Amazon.com or Barnes & Noble, or in Spokane, it's at Auntie's Bookstore. Read it, learn about what we can do about our health. All right, and in closing, I'd like to introduce my work family team at the Prevention Center for Heart and Brain Health in Spokane, Washington. We are available, we are here, and today, this was taken today, we all wore our Go Red for Women shirts and sweatshirts and promoting women's heart health. I have a huge respect for the Red Dress campaign. I just feel that there's a lot of fear in that tells us we're at risk. And my hope tonight is that you learn that you can do something about it. And you hold the keys for optimal health. So I respect and appreciate all of you. There's no shame to heart disease. We are all vulnerable. And so don't be shy. Don't put your head in the sand. Let's change these statistics through awareness, advocacy, and action. I thank you all very, very much, and I hope you have a wonderful evening.